أكبر الله أكبر.
I'm a medical student attending SIMAD University, and we just completed our final year of medical school doing a medical internship in Rwanda. So my experience here in Rwanda was really a great one. I think we got a 2-for-1 deal, if you will. We got medical experience and we also got life experience. So it was really nice for us to come to Rwanda, see the culture, see the people. They welcomed us with open arms, and I don't think we would have had a better opportunity anywhere else. So it was really nice.
It was last year when we visited this beautiful country of Rwanda, a team led by the university director, Dr. Dahir Hassan Abdi, and SIMAD University Academic Council, where we visualized and how this country has developed in so many areas, including the health sector. Especially we paid visit to the University of Rwanda and a couple of other hospitals to see how they do clinical and training education as well.
We received these students from SIMAD University last year in September. So it was the first time to receive the whole class at the same time. And they came here for internship, for 1-year internship. And they have to rotate in 4 main departments: surgery, pediatrics, internal medicine, and gynecology and obstetrics. So they spent 3 months in each department. They was received like Rwandans. I should mention also that we received other students coming from US, from Europe, from Canada, but this time it was a student coming from a sister country in Africa. So it was a pleasure to offer to them an environment where they can learn and acquire knowledge and skills.
First of all, I want to thank University of Rwanda and University Teaching Hospital of Butare for hosting us and providing us with excellent academic and clinical training. We have learned a lot from the professors, doctors, and nurses, and other staffs who have been very supportive and very helpful throughout our stay.
The way that this internship impacted us, specifically, let me speak for myself, it really showed me how amazing the medical field is, sitting one-on-one with a patient, them expressing what their issues, and then you helping them, and then seeing the smile on their face when you're able to help them. It's really a gratifying experience, and I don't think in many fields you can get that same type of feeling, so it's really amazing.
Before, it was very hard because we had no any idea about the culture of the patients that we were dealing with, and also the team that we have been working with. But along the way, we have learned from them by, supervising what they are doing, how they are acting. We were also curious and asked them, about anything that we think, it's not really something usual to us. So that was how we overcame or adapted to this.
I got a lot of experience working with the patients, working with my seniors, residents, and also the internists, dealing with some diseases for treatment, diagnosis, and also I got to some skills in like surgery and gynecology for delivering a babies, making a C-section. So as I believe it was a good time to take my internship in Rwanda, especially in Huye and University Hospital.
The most significant one was the language barrier, of course. You know, coming here, we knew the people spoke English, but we didn't know that when we come to this town here in Huye, that most of the patients we're dealing with are from the rural countryside. So we didn't expect that we would have those difficulties, but we had local medical students that were very helpful, helping us translate, communicating with the patients. So they were really helpful, and we appreciate it. So I'd say that sitting in a classroom and actually being in the hospital are two different things. Like sitting in the classroom, we've been doing it all through grade school, and it becomes a little bit repetitive. But the difference is when you're in a hospital, you're in the action. You're getting to see patients, you're getting to interact with the doctors. You feel like you're actually in the medical field. So it's really it's a big difference. So I feel like we've actually starting to feel like doctors now. So it's a great feeling.
The most crucial skills that I have adopted during my internship were communication, teamwork, and ethics. And the way I refined these skills was by observing our seniors, our other medical students from Rwanda, the way they are dealing with the patient, the way they were very compassionate with the patient.
We worked as a team, so we learned from them, from what they have learned from Somalia, and then they learned from us. So I think the experience, and we had like teaching tutorials, which was very beneficial for us. So I think that's how we learned from each other.
I have had the opportunity to participate in various, clinical rotations, workshops, seminars, research projects, who have, enhanced my understanding of various clinical diseases, treatments. I have also learned about the challenges and opportunities that Rwanda, faces in improving its health outcome and achieving universal health coverage. And I have also been inspired by the innovative and collaborative solutions that Rwanda has implemented to address the healthy needs. And overall experience, it was one of the most rewarding and most memorable ones in my life. It has not only enriched my medical education, but also my personal growth. It has broadened my perspective. It has challenged my assumptions. It has strengthened my values. It has also given me a hope for the future of Africa and the world. And I'm very grateful for this opportunity, and I hope to maintain the connections and the friendship that I have made during my stay in Rwanda.
Always I like to be a doctor, since in childhood. So I always wanted to support my people, to save some lives. That's what motivated me to being in a medical profession.
So for me, I'm planning to do orthopedics for my residency. So when I was rotating in surgery, there was a doctor by the name of Dr. Olivier, and he's an orthopedic surgeon, and he really helped me to learn the field of orthopedics, and he really gave me his confidence when we're in the operating room, assisting him in the OR. He was giving me the drill, helping me, teaching me various procedures. So he's really the one who really guided me, and I appreciate him for that.
We really encourage this collaboration between countries, but specifically between African countries, because we are convinced that we can help each other.
I want to thank Rwanda as a country. I also want to thank Sashipe staff, all the doctors, all the nurses, and all the midwives. So before coming here, we didn't have any idea about Rwanda, so we were thinking like it's going to be different. We didn't know how the people will be. So, but after coming here, we really enjoyed They are really nice people, really humble people. We didn't feel like as if we were feeling like as if we're in our own country. So I want to say thank you so much, Rwanda. And also as a responsibility, I believe we will take everything we learned here and take it back to our country and improve the overall health status of the country.
One thing I can say, I appreciate the school, like who sent them here, because we got to learn a lot of things from them as well as for us, and we had a good friendship, which is a very good thing I can say. Yeah, I think that's all. Yeah, and we had a good time. Yeah, it's not all about the hospital. Yeah, we chill outside. So that's what I can say.
So the biggest piece of advice I would give the next group is to stay focused, because over a year's time, focus can go up and go down. So I feel like they should stay consistent, and this is an opportunity that most people won't get, especially coming from Somalia. So they should take advantage of it and really appreciate what they have here.
So I would tell them to prepare for the challenges and opportunities. I would tell them to be flexible and to be passionate about what they are doing. And I would tell them that this is a very good opportunity for them in terms of academic development and also personal growth. And they will not regret it, and they will learn more about from the Rwanda healthcare system and the culture. They will make new friends and they will experience new things. So they will have a great time here. I also want to express my admiration for the people of Rwanda who have shown us their hospitality, kindness, and resilience. And I have been very impressed by their spirit of unity, reconciliation, and development. I have witnessed the way they have overcome their past and built a peaceful and prosperous nation.
Based on the experiences that the students really shared with us, and also based on our first observation when we first came to this country, we realized how the system is really, really very helpful for the students. And as our students has reported, they have gained a lot of knowledge, a lot of clinical practice, a lot of clinical knowledge. I think they have gained a lot of experiences for the 1 year that they have been here. And all of them, I can say all of them are extremely happy that they came and choose Rwanda as their destination to do their internship.